चालू कर दो, मैंने कर दिया। हाँ कर दो कर दो। Yeah, hello guys. So I'm Dr. Dinesh and we are going to discuss this pharmacology recall session. So in this we are going to discuss some of the questions which have been asked in NEET PG, but all these are recall based questions. Definitely the language of the question will be totally different, but this is basically we are discussing the topic and definitely we are trying to give the correct answer. So let's start with the question. I hope I'm audible and visible. Okay. The language of the question will be okay. So let's start with the question number 1. A patient with CKD having anemia, the best drug to treat this anemia. I think this was one of the simplest question. Patient of CKD having anemia, there is no confusion in this question. In anemia, in these cases we cannot use iron. This anemia is in the CKD, so our purpose is to give the recombinant erythropoietin. So what is the correct answer in this case? We use the darbepoetin. Because filgrastim is the drug that is for neutrophils, that is for granulocytes, that is for agranulocytosis. Grastim, granulocyte stimulator. Oprelvecin, that is interleukin, that is for platelets. So the correct answer in this case will be darbepoetin. I hope there is no confusion in this question. Everybody has got the correct answer. It is darbepoetin is the correct answer. Okay, so let's see the next question. Oprelvecin, that is interleukin. Okay, so let's see the next question. A female underwent emergency LSCS for some indication. A case was given, the best drug to prevent venous thromboembolism. The risk of DVT is there because of the cesarean. So basically you can say after surgery there is risk of thrombus formation. To prevent this thromboembolism, we give some anticoagulants. So what is the best drug in this case? So now you can see most of the questions were integrated questions. This question was integrated with the OBG, OBS-GYN. So in this case what you will do? So definitely for anticoagulant purpose we cannot use this drug. Aspirin is antiplatelet. So this is not definitely the answer. The next is DTIs. DTIs has not been approved for these cases. DTI has not been approved. They have not studied for these cases. So we have these two options, warfarin and LMW heparin. The correct answer will be LMW heparin. LMW heparin is the correct answer because warfarin, the two reasons. One, it is slow. The second, the risk of bleeding is very high. So that's why we never use warfarin immediately after these surgeries. So the best answer will be LMW heparin. Even the heparin is safe, but still the best answer will be LMW heparin. Right? The LMW heparin will be the correct answer. LMW heparin will be the correct answer. Okay. So I hope you got this correct. Okay. So the next question is, so this is the LMW heparin. Next question. Integrated with the psychiatry. So I am telling you integration in pharmacology. You can see the integration. The schizophrenic patient on haloperidol since last 2 years presented with the orofacial dyskinesia, coriform tick-like movements and dystonia after 2 years. So just imagine after 2 years, very long period, which extrapyramidal symptom occur very late. Yes, bache. Good morning, everyone. Good morning. So now tell me the answer. Tick movements, dystonia, orofacial movements, dyskinesia after 2 years. So very long. It is one of the extrapyramidal symptom. So what is the diagnosis and the drug given to treat this case? What is the diagnosis and drug to treat this case? So this is a typical case of tardive dyskinesia. These reactions are not immediate, so it is not dystonia. There is no akathisia symptoms. There is not only tremors. We have the tardive dyskinesia case, and the best drug to treat tardive dyskinesia is valbenazine. So these all drugs have been discussed in the class. If you know the drug and if you have studied other subjects and you know the integration approach, then definitely all the questions were very easy. But definitely it was not very easy because integration was there, so you should know the other subjects as well. But this we have discussed so many times in the class. Extrapyramidal symptoms, okay, these are the extrapyramidal symptoms, what is the best drug, so we use this, already discussed in the classes. Okay, let's see the next question. Then this question, a very simple question, child presented with the fever and seizures. I think every bacha knows febrile seizures. This topic we discuss in pharmacology as well as pediatrics. Febrile seizures case, a case of febrile seizure, what is the best drug for treatment or even for prophylaxis? The best drug in this case we use the diazepam. The best drug we use is the diazepam, because phenytoin, valproate, these are not for febrile seizures. Ethosuximide is for absence seizure, T type of calcium channel blocker. So out of these, diazepam is the correct answer. That is the drug of choice for febrile seizures. So you can see in this case the correct answer will be diazepam. So this is again a simple question and frequently asked question as well. Next question, integrated with the anesthesia. Next question, integrated with the anesthesia. After giving SMR, skeletal muscle relaxant, the patient developed flushing, hypotension. Bete kya hi jaldi hai Sai Ram, there is no need to be hurry now, because now the exam is over, we have to see the correct answers, right? Yeah, definitely. NEET PG marks for review. Mark for review is okay, but if you have given the correct answer, then definitely you will get it correct. So developed flushing and hypotension. Which drug not cause this? So I told you many times that when we say cis atracurium, that is the enantiomer of atracurium. Whenever we use the enantiomer, I told you, whenever we use the enantiomer, the biggest benefit is you can avoid the side effect. Then cis atracurium, you can avoid the side effect. You can avoid the histamine release. So definitely there will be no hypotension, no flushing. So that is the correct answer, cis atracurium. बच्चे डॉक्टर विवेक, अगर आपने बेचा मार्क किया है, क्वेश्चन को मार्क कर दिया, उसके बाद रिव्यू कर दिया, कोई बात नहीं, मार्क कर दिया तो वो काउंट होगा, रिव्यू से कोई फर्क नहीं पड़ता, रिव्यू किया नहीं किया कोई फर्क नहीं पड़ता. ओके, so this is cis atracurium. So this type of case was there. Okay, Sai Ram ji, can you give me the reason for that? Any reason for that, bachche? Next question is Pheochromocytoma patient preoperatively, what is the best drug to control hypertension in these cases? So that is one of the frequently asked question from the ANS, autonomic nervous system. The preoperatively to control the BP, the best drug we use is the alpha blockers. But definitely if you say which drug can cause anaphylaxis or histamine effect, then definitely you go with the atracurium. But if they ask you not, then definitely cis atracurium. Now it all depends on the question. Most of the students are saying this was the question, so I have given this answer. But if you say the opposite thing, then definitely atracurium was correct, right? I am not going to define that. So alpha blockers are the best drug to treat this. So it is the phenoxybenzamin, which is given preoperatively, and phentolamine is given intraoperatively. So definitely alpha blockers are the overall best option in these type of condition. Not clonidine. Clonidine cannot be used preoperatively for this purpose. In Pheochromocytoma, we use the phenoxybenzamin, Anish, right? Even if they ask you pre and post operatively, then also phenoxybenzamin. Alpha blockers are the best option, right, Anish? Okay, so let's see the next question. Then also Akshay, the answer will be same. Okay, let's see the next question. There was a question, best drug to be given for meningococcal meningitis prophylaxis. This was a question integrated with the microbiology. They have given like diplococci and all. So definitely if you know meningococcal, then In meningococcal prophylaxis, we use rifampicin, but in India we use the ciprofloxacin. But ciprofloxacin was not there in the choice, so definitely the answer will be rifampicin. In the treatment we use ceftriaxone. In the treatment we use the ceftriaxone. So what is the correct answer? In this, the correct answer will be rifampicin. Rifampicin is the drug of choice for prophylaxis, right? Obviously. Even बच्चे, if ciprofloxacin will be in the option, then definitely ciprofloxacin. Okay, this was one of the simplest question from the monoclonal antibody. I always say one question is definitely coming from monoclonal antibody. So benralizumab used in asthma, so acts via inhibiting. So mechanism of action of benralizumab was asked. It is not interleukin 4, that is dupilumab, that is D. I told you D is number 4, that is D, interleukin 4. Rest of the drug, benralizumab, racemilizumab, these drugs are interleukin 5. So benralizumab, racemilizumab drugs are interleukin 5. In TNF alpha we have the infliximab like drugs, and this is anakinra like drug. So the correct answer will be interleukin 5 receptor, important drug for bronchial asthma. Okay, let's see the next question. A patient diagnosed with rifampicin resistant TB, rifampicin resistance. So बच्चे interleukin 5 I given the correct answer. So rifampicin resistant TB, appropriate regimen to start in this case is, so whether rifampicin resistance in India we always treat like MDR TB. So give the MDR TB regimen. So what is the MDR TB regimen we use in this case? So one of the PYQ, one of the PYT, one of the very recent important topic in these type of condition, we use the B-PAL-M regimen. We use the B-PAL-M regimen, and many students are saying, sir, in this the case was given as HIV and what to monitor. If you need to monitor, then definitely monitoring of immune reconstitution inflammatory syndrome, IRIS, right? Ishanji, now this is the complete question, because many students are saying HIV was there. So in HIV patient, when we start the drug, then monitor the IRIS, immune reconstitution inflammatory syndrome, right? Okay, so Ishanji, now it is correct. So B-PAL-M regimen and monitor the IRIS. So that is the correct answer. Okay, so duration was different. B-PAL-M regimen question was not having duration question was different. Okay, one of the very important topic, HIV and TB, we have done separate short course for HIV and TB. Pregnant patient with HIV recently developed TB, when to start the ATT or ART, this type of case was given, and we have discussed so many times that in TB or HIV patient, a patient of HIV having TB, first we need to start the ATT and then we need to start the ART. As in the previous question I told you, immune reconstitution inflammatory syndrome risk is there, so in 2 weeks you can start the ART. We never use simultaneously, we never use ART first, or definitely will not give the ATT. So this was the question, this type of case was given. Again I would say it is not the complete language, this question is not the exact question, these are just recall based question. So that's why I am saying this type of case was there and this was the correct answer. Okay, let's see the next question. So you can see from HIV or TB 2-3 questions were there. In HIV positive mother with high viral load was given. Can you tell me the value of viral load? High viral load was given, mother was started on ART. Definitely if the mother get positive or mother found positive, right, during pregnancy, then first thing we do is start the ART to the mother. Then what is the best for newborn? So what is the next step or best for newborn prophylaxis? So in this type of condition, if the viral load was high, that means it is the high risk. In high risk mother we use the dual therapy. Okay, so 1200 is definitely the high viral load, so we give the dual therapy. In dual therapy we use the zidovudin and nevirapine. Okay, 34 weeks, no worries, even if 34 weeks, start the mother on ART and give the prophylaxis. Okay, so we start the zidovudin plus nevirapine. Dual therapy has to be given, and if with breastfeeding, then it is definitely for 12 weeks. Without breastfeeding, it is for 6 weeks. So zidovudin plus nevirapine for 12 weeks and exclusively breastfeeding. No, bache, Abraham ji, why see? We cannot give zidovudin alone. We give zidovudin plus nevirapine for 12 weeks with exclusive breastfeeding. If breastfeeding is not exclusive, then we can go for, in Indian setting, definitely in Indian setting we advise for breastfeeding, because breastfeeding is must in India. Okay, then also the answer will be zidovudin. So Indian setting ye lo ji, ठीक है. Okay, so the correct answer will be zidovudin plus nevirapine. You can correct me if any doubt in the question, because again I would say it is not the complete question. I don't know the complete question. You guys has given the exam, you know the exact. Amiodarone, this was the simplest question based on the mechanism of action, which phase of action potential. So you know amiodarone is class 3 drug, and whenever we start the antiarrhythmic, we always discuss this graph. So in class 3, it is the potassium channel blocker. So definitely it is going to inhibit this one. There will be increased QT prolongation. So this is phase 3. I think every bacha knows this. This is phase 3. This was the simplest question. Mechanism based 2-3 questions were there this time. So very simple question. Yeah, Anita ji, definitely. That's why we are saying 1200 is high viral load. Okay बच्चे, okay, तो phase 3, no problem बच्चे. आपका करेक्ट होना चाहिए यार, दिस इज माई एम. आप सबके क्वेश्चन ठीक हो, आप सबकी अच्छी रैंक आए, दिस इज द ओनली एम. एज ए टीचर वी कैन ओनली प्रे दैट, and I know you guys have done wonderful. A hypertensive patient under treatment, one of the most controversial question, but I will give you the correct answer, don't worry. Hypertensive patient under treatment develops renal stone. So patient of hypertension, hydrochlorothiazide was given. Now the patient will be, yeah, definitely. Then also Divyaji, then also we treat like MDR, because in India we give the MDR regimen. Okay, so hydrochlorothiazide was started. So hydrochlorothiazide, usually it decrease the calcium stone. First try to understand this question. Usually it decrease the calcium stones, but some patients develop the renal stones. So if the after thiazide, if renal stone develops, because this was the question, if renal stone develops, then what is the reason? I think this was the question. Then what is the reason? Am I right? This was the correct question. What is the reason if the renal stone develop after thiazide? If the question is if after giving hydrochlorothiazide patient is having renal stone, yes. So Divyaji, that's what I'm saying. Then the answer will be decreased citrate excretion. This is the correct answer. Patient was already on thiazide and then got the renal stone. Then definitely the correct answer will be decreased citrate excretion. And that leads to, because it decreases the calcium excretion without any doubt, but by that it cannot cause the renal stone. By that it decreases the risk of renal stone. If decrease the citrate excretion, that can leads to increased renal stones risk, that increase the risk of renal stones. So please correct it. Thiazides are having one paradoxical effect on the renal stone, decrease the citrate excretion, and by this, so those who are saying ki decrease the calcium excretion, but that is statement is correct, but that cannot cause the renal stone. ठीक है बच्चों, so this was the correct answer. Many students have done this wrong, I know, I can understand, right? मैं भी होता तो हो सकता मैं भी गलत कर देता, but this is the correct answer बच्चे. ठीक है, okay. A patient was given, Akshay ji, that's what I'm saying. Patient was given succinylcholine and sevoflurane and developed high grade fever and all. So this is malignant hyperthermia. I think every bacha knows malignant hyperthermia. I think every bacha knows the treatment of malignant hyperthermia. That's what Pratibha ji we are saying ki patient after thiazide developed stone. Correct answer will be citrate. ठीक है, this is the correct answer. Decrease citrate excretion. Thiazides decrease the citrate excretion and that can cause the stones. ठीक है, no, Rohit ji, due to calcium they cannot cause stone because they increase the calcium absorption, they cannot cause the stone, right? तो stone वो ठीक है. अब बच्चे बाकी तुम जानते हो भाई करेक्ट क्या था ऑप्शंस, ठीक है. सक्सिनाइलकोलिन एंड सिवोफ्लोरिन. तो मैलिग्नेंट हाइपरथर्मिया, एंड इन मैलिग्नेंट हाइपरथर्मिया आई थिंक एवरी बच्चा नोज द करेक्ट आंसर. इट इज़ द डेंट्रोलिन सोडियम. Dantrolene sodium is the correct answer. That is the drug we use to treat malignant hyperthermia as well as neuroleptic malignant syndrome. Okay, so the correct answer every bacha knows. This is the correct answer. So dantrolene sodium, patient on succinylcholine, sevoflurane. Okay. राकेश जी सिंह की तो भी बच्चे तो भी आंसर चेंज नहीं होने वाला. प्रेफर्ड ड्रग फॉर prophylaxis of PSVT. I think this was the question, prophylaxis of PSVT, and this is one of the simplest question. This was the simplest question. This was the simplest question. In prophylaxis of PSVT, we use the oral verapamil. Oral verapamil, calcium channel blocker. That was the answer. I think every bacha knows this. This was one of the simple question. PSVT prophylaxis. Okay, so the correct answer will be verapamil. Okay, let's see the next. Yeah, Asif ji, thiazides are used in renal stone, but they have one paradoxical risk. Okay, chaliye. Yeah, I can understand definitely, and recall is tough for us as well, because whatever you say, we try to frame the question. So definitely recall is tough, and this type of question, when the lengthy questions, long question integrated, then definitely the language is very important. If language changed, the answer could be changed. But I asked so many students about the questions, and then I framed the question. Okay, patient of diabetes, I think there is no confusion in this question. Patient of diabetes present with the reduced ejection fraction of the heart. So this is one of the simplest question. Again, some questions were very simple this time, but 3-4 questions are definitely tougher side, in which the students are confused with the language. Question was not tough, topic was not tough, the language was tough. So which drug? So I think every bacha knows gliflozin. Gliflozin. So it is the empagliflozin. Yeah, Karthik ji, if miliary TB, then definitely we need to think it again, right? So gliflozin is the correct answer. So this is one of the simple. Gliflozin is the correct answer. I think every bacha knows this, gliflozin. Again, this was the question. Many students got confused. Drug increasing the tone of lower esophageal sphincter, having prokinetic property, used in GERD. Now see, we are using all these drugs in the GERD. Okay? Used in GERD. We can use the vonoprazan in the GERD. We can use the omeprazole, but these are not prokinetic. They are not prokinetic. What is the prokinetic? The prokinetic drug out of this is metoclopramide. Okay. Many students are saying that sir, ranitidine is instead of ranitidine there was sodium alginate. Then also the correct answer will be metoclopramide, because it's a D2 blocker and it is 5-HT4 agonist. It's a wonderful drug for GERD patient, right? So then also the answer will be metoclopramide. It's a prokinetic drug. Okay? Alginate is just increasing the surface tension of the layer, so it is preventing the reflex, but not the prokinetic drug. Okay, prokinetic. This question was there. Atrial fibrillation, hemodynamically stable, present with the symptoms. Now this is integrated with the medicine. I don't know the exact case, so I will not comment on the correct answer. But if simply they ask the atrial fibrillation only, then definitely we control the rate. But if the time duration was there and if the TPAs and all was asked, then definitely the question was different completely. But some of the students gave me this question. In this question the answer will be control the ventricle rate, but again medicine people will definitely tell you the exact question if they come to know an exact answer. But if only this was the question, hemodynamically stable patient and control the ventricle rate, yes, definitely we need to control the ventricle rate. If the patient present within 4 hours, okay, 4 hours presentation was there. So if atrial fibrillation, then definitely the answers will be okay. Question was different, so let's forget this question. If they ask the RTPA or T, then definitely the question is different, and the medicine people will comment, and then I would say the answer should be RTPA, but I would not comment. Okay, leave it. Pegloticase, this was pharmacology question. Pegloticase mechanism of action to use in the tumor lysis syndrome is. So pegloticase is one of the drug which is recombinant bird uricase, rasburicase like drug. So uricase, so what is the role of uricase? It is causing uric acid oxidation. The uricase is one of the urate oxidase. It is the urate oxidase. Okay. So urate oxidase is there to decrease uric acid synthesis? No. Increase the uric acid oxidation? Yes. It is the uric acid oxidation which convert is to uric acid to allantoin. Right? So it is not the secretion, it is not the inflammation, it is the increased uric acid oxidation. Even if hydrolysis is there, the correct answer will be, so instead of this uric acid hydrolysis, okay, yellow G. This is wrong. Oxidation, because it is the urate oxidase. So uric acid oxidase. So that is the correct answer. Uric acid oxidation. Okay? The correct answer will be uric acid oxidation. One of the again controversial question. A woman with family history of CAD is suffering of migraine, now presented with the chest tightness and all. After triptan, if there is chest tightness, okay, the patient of migraine, recurrent history of migraine, best drug for prophylaxis in this case is, okay Aribaji, okay. So what is the best answer in this case? So see, even if CAD patient, beta blockers are not contraindicated. The patient is having chest tightness after triptans, so definitely we cannot suggest the triptan to this patient. Triptans or ergots are for acute condition, and due to triptans or ergot the patient may have the chest tightness. If the patient is having family history of CAD, then also for prophylaxis the best drug will be beta blocker. Even beta blocker decrease the risk of CAD. Definitely if propranolol and metoprolol in the choice, then answer will be metoprolol. But out of these the best answer will be propranolol, not the topiramate, because topiramate is not having any specific role in the CAD patients. The benefit of propranolol, that it can decrease the risk of CAD. So beta blockers are the best option in this case. I have read the language beta blocker. Okay, आ जाओ बच्चे. ये लो जी आपका और controversial question. Even for prophylaxis, Divyaji, beta blocker will be the correct answer. A female patient having oral pigmentation, some image was given which is having burning sensation after spicy food, drug causing these lesions. This was integrated with the derma. So lichenoid type of lesions. If lichenoid lesions were there, then definitely lithium is the correct answer. Okay? Even if chest tightness was there or not, doesn't matter. Best option was asked, Dr. MS, best option was asked, so beta blocker, there is no problem in that. Why to use topiramate unnecessarily? Topiramate is having so many side effects, so we cannot use the topiramate. Topiramate is good drug if the patient is having mood problems and all. Okay. So then if lichenoid type of lesions are there, then definitely this is the lithium. Okay, lithium. I discussed with the many dermatologists. Definitely not the option, not the answer. So beta blocker or lithium. If exact image, I don't know, but as per these lesions, lithium should be the correct answer. Okay. So these were the questions. One is integrated with the pediatrics about the case of diabetic ketoacidosis. Not useful were asked. Not useful. Then definitely we use this. We never use this in these type of cases usually. So this is hypertonic saline. Why to use hypertonic saline in these cases? Some are saying ki monitor the potassium, then also it is fine. So this is not the we use. So 3% saline is the correct answer. Okay. So बच्चे, these were the questions. Around 20 to 25 questions were there from pharmacology, mostly mechanism based questions or clinical cases were asked. Some are confusing questions, but by asking the language from many students, I tried to give the correct answer. So that's all from my side. I hope that is fine, right? So Divyaji, if hyponatremia, then definitely we can give. If hyponatremia, then definitely we can give. But that's what I am saying. Ki pediatric people will definitely tell you the detail, because I don't know the exact detail of the parameters. Okay. So if hyponatremia, then definitely we can give. So I hope that's all. So I wish you all good luck for your exam, and we will pray definitely you will get the best result. So thank you, and you can follow me on Instagram, and we will discuss more and more about these questions. If you will share the image and exact language, then definitely I will try to give the more correct answer. That's all from my side. Thank you, bache. Thank you. Thank you. Bye bye. Take care.